It's going to provide a space where we can eliminate some of the noise, the doom scroll, and all the stuff that's in our feeds, and come together as a community so that we can amplify our voices. We can hear ourselves think. We can take a deep breath. We can have a space to share our ideas. Greetings, everyone, and welcome to the Public Health Roundtable discussion. I'm excited to have our panelists join us today, and I'm going to introduce everyone, and then we're going to dive into our topic. So if you're joining us live or watching the replay, please share this with your network. Just reshare it with your network right here on LinkedIn. We want this to be interactive and a full discussion. So it's not just what we have to say about the topic today, but what you all are sharing with us in the comments. Although we can't respond while we're live, we will always go back to those comments as you add to them and keep this conversation going. So my name is Dr. Charlotte Huntley, and I'm a public health entrepreneur. I am the CEO of Dr. C.H. Huntley, LLC, which is a epidemiology consulting firm. We essentially help our clients, which are typically large nonprofit organizations, communicate their health information and data in plain language to communities they serve. And so how we show up looks very different depending upon the client and the needs, but that's essentially what we are aiming to do. We want to help inform individuals, client organizations, everyone to be able to understand the reports and the deliverables and the information so that they can make informed decisions. I am joined today by an incredible panel. Some of you already know the folks that are on the panel with us, and we are going to be chiming in with a topic that aligns with National Public Health Week, which is this week, in case you're not familiar. And just so you know, and getting ready for the topic, it's going to be about amplifying voices in public health. Advocacy starts here. So this is kind of where we're going to land today. But before I get too far ahead, let me back up and pass the mic around so that we can introduce our panel. So I'm going to go to you, Christy. Introduce yourself, please.
Yeah, thanks so much, Charlotte. I'm very excited to be here today. So my name is Dr. Christy McClamrock, and I am an epidemiologist, a public health entrepreneur, and also the CEO of Courageous Public Health, which is a new consulting firm. So at Courageous Public Health, we are turning up the volume on courage within women, particularly BIPOC women in public health. We support public health organizations through workshop design and facilitation, and also through speaking engagements. Very happy to be here.
Thank you so much for that introduction and the work that you're doing. I'm going to go next to Dr. Joy. Please introduce yourself.
Hi, everyone. I'm Dr. Joy Washington. I am a community engaged research consultant, and I'm the CEO of Joy Washington Consulting, LLC. So I help organizations successfully implement community engagement strategies for research and practice. Our mission is really to revolutionize public health by transforming public health research into life-changing public health solutions. And so we accomplish this by working with community-based organizations, nonprofits, public health organizations, to build meaningful community partnerships, conduct impactful research, and then create data-informed solutions that bring joy to our communities. And I'm also the host of the Public Health Joy podcast. So that's a safe space where we have real conversations about creative and innovative approaches to public health research that's done with, for, and by our communities. I don't know if there were any other questions. That's my general intro because I missed everything before this.
That's fine, though. We're just doing introductions. We're going to dive into the topic here in a minute, but you did a great job. Thank you for that, and thank you for what you do. And we're going to pass over to Dr. Ginger Dixon. Please introduce yourself.
Hi, thank you. I am Dr. Ginger Dixon. I'm the owner and founder of One Life Epi Solutions. And what we do is we help to support One Health strategy and operationalization through data and education. So we have kind of two arms. We do consulting and support, bringing insight and strategy from a One Health perspective to help organizations with either short-term with outbreak or natural disaster event support, or long-term by working One Health into their infrastructure and their strategy, their training, education, and their data. So I'm also an epidemiologist. I always love seeing the data people here. And so our other arm that we do is we also do youth education on One Health through our One Health Kids program. So that looks like lesson plans and ebooks. And then I'm also a host of One Health Wednesdays, where we get to bring on other experts and hear hear from them in One Health. So again, really excited to be here. Thank you.
Yes, thank you for that introduction as well, and for what you do. Yeah, we've got quite a mix here on our panel, covering a lot of different areas. We're all the what we have in common is we're all entrepreneurs, consultants in public health, and we are covering very different areas. So I'm excited to dive into our topic. So let me put this back up on the screen. Again, this is National Public Health Week, and I can't remember if this is the one of the themes of the day today, or if this is actually tomorrow's theme. So if we're a little ahead, it's okay. But amplifying voices in public health, advocacy starts here. That is going to land very differently with everybody. And acknowledging, where we are in public health, these are very stressful times for all of us. With that being said, I'm going to just like we're acknowledging, the elephant in the room, so to speak. This is where we are. I think that there's so many things that can be done, and there's still so much work to be done, things that we can do address that. I want to really focus on this theme of amplifying voices, and I want each of our panelists to share in what ways are you amplifying voices in public health and in advocacy. If you want to really lean in more specifically, I'm let you kind of go how you want to go with that. I'm going to just share with you, there's probably 5 or 6 different things I could bring up, but this is the freshest one for me. And that is, you may have even noticed that there are some posts that we've had about our celebration, because I do host the Public Health Epidemiology Conversations podcast, and we are approaching our 400th episode, representing 400 weeks every single Tuesday for 400 weeks. That's a long time, a lot of conversations. We're celebrating that. We're celebrating that in a very big way. And I have to tease it a bit because I'm building this all up to explain on this. If you register for our celebration, you'll get all the details. So I can't, give out too much because I have to save some for the people that are registering and waiting for the details. But what we are rolling out and what I'm going to be sharing at that moment when we celebrate, and this is one of the biggest ways to celebrate, is something that I think is like so timely. It is something that is absolutely going to provide a space for us. And I've shared this much of it. It's going to provide a space where we can eliminate some of the noise, the doom scroll, and all the stuff that's in our feeds, and come together as a community so that we can amplify our voices. We can hear ourselves think. We can take a deep breath. We can have a space to share our ideas and extend, some of the conversations that we hear on those episodes, continuing those in those community spaces. And I think the magic happens in those moments, when we have a chance to rest and to be in a safe space and to just think. We're brilliant. We all have great ideas, and we have a lot of experience, our collective experiences. So I'm really excited about that. That's something that is my way of helping to amplify voices. And again, the advocacy starts there, but it's just going to be almost like a rest place for us to release and to start to think and to figure out what is next. So that's a bit about me and what we're doing. Very excited about it. And I can't wait. If you haven't registered, you're not sure what I'm talking about, I'm sure one of my team members, because Amber usually thinks ahead, she'll get that link and add it to the comments. If not, just send me a direct message and I will send you the registration link. I really want you to be there when we celebrate. Celebrate with us. It's going to be a lot of fun. If nothing else, it'll be a break in your day, which will help you have a moment of rest, which can go a long way in helping to amplify your voice. So I'm going to pass the mic over to Christy. Dr. McClamrock, I would love to hear from you. How are you amplifying voices in public health, and what does this mean for you?
Yeah, thank you, Charlotte. I think that this is such an important topic. I am so glad that this is the topic for today. You know what? It's funny. I knew that National Public Health Week was coming up, and when you said it, it was like, oh, right, it's this week. It's here. So yeah, this is a great topic. So, in terms of amplifying voices, not only are we all public health entrepreneurs, but we are all podcasters. So I am in the process of starting the Courageous Public Health podcast. It will be launching soon. And I think that, podcast platforms are a great way to amplify voices. So for me specifically, I've created the Public Health Podcast to be a space for courageous Black, Indigenous, and women of color who are working in public health. So it's a space that really centers their voices, celebrates their passions, and amplifies their courage. I am all about courage. I'm really leaning into courage these days. I think all of us need to have some courage right now. I'm reminded that bravery is taking action without fear, but courage is taking action despite fear. And I think most of us are experiencing some level of fear right now about what's happening in public health, what's happening to something that we all care so deeply about. And we need to still take action despite that fear. The fear can't slow us down. I read the Caitlin Jetelina's new post today, which was, discussing all of the programs that have been dismantled and gutted, and, how difficult this is going to make things for our future. When we don't have prevention, then we will have a lot more disease, right? And that is going to have big implications on everyone in our country. And, that really reminded me of how important it is to have courage. So anyway, the podcast is going to have real unfiltered conversations with BIPOC women about the challenges that they face and the power they hold and the vision for their future. And I want to lean into authenticity and vulnerability and courage. And it's not just courage in our professional lives, it's courage in all of our lives. It's just been a real pleasure to start talking to BIPOC women and hearing their stories. It's a real pleasure for me to be able to do that. So that's sort of the way that I am focusing on amplifying other voices and amplifying my own voice too, right? And amplifying voices and also just like taking up space. Take up the space. We all get to take up the space. And I think that's really important as well. So thanks so much, Charlotte. Thanks so much for having me.
Well, thank you for sharing that. Yes, I'm excited about your podcast and what you're doing with that. And Dr. Joy helped me realize that we're actually a little early. So actually National Public Health Week is next week. So we'll reshare this again all fresh. We're excited about National Public Health Week.
Okay, so I'm not losing my mind that it was like, I didn't realize it was this week. It's not this week. It's next week. Okay.
I'm going to pass the mic over to you, Dr. Joy. And please, same question, talk to us about how you're amplifying voices in public health and advocacy. What does that mean for you?
I will say, as I thought about this question, I think one of the ways that I focus on amplifying voices in public health is the focus on joy. That has been my message since I have started, and especially in times like these, when a lot of us are feeling heartbroken, a lot of us are feeling hopeless and helpless, and we're feeling the weight of the trauma that's happening, and we know that for decades to come we're going to feel the impact of this. It's also in times like this that our joy cannot be lost, and that is the message that I try to push, is that even in times like these, joy can still be found. That joy is our choice. And as public health professionals, as an industry, we still have communities to serve. There is still work to be done. We have to figure out how to do it differently. And for a lot of us in this profession, public health is our calling, it's our purpose, it's our passion. And that does not change because the circumstances around us change. That is not the case. This is an internal situation that we have to address, and we cannot allow our voice or our joy to be lost in the midst of it. So that is an important part to me of amplifying voices. And for those who still have their jobs, who still have work, who still have their businesses, how do we build resilience? How do we build community? How do we collaborate? How do we build a stronger force? And I've been sharing this message a lot lately, since January the 20th, really. But been sharing the message that although there are a lot of challenges, there's also a lot of opportunity here. It's not a matter of if the next pandemic or if the next public health crisis is on the horizon. It's when. We're still going to be needed. There's still going to be work to be done. It's just a matter of it's going to look a little bit different. So we're still here. We still trucking. We're gonna get this thing done. And sorrow endures for a night. morning endures for a night, but joy comes in the morning. So that's what I'm looking forward to in terms of amplifying voices in public health.
Thank you so much for that. I love it every single time you remind us of, and every time I hear you talk about joy and public health joy. And I absolutely agree with you. Was reminded just briefly a few moments before joining this live call, on a walk with my neighbor as we were talking about, life and sharing stories. And she's recovering from a traumatic injury, and she's a social worker. So we're already very aligned, but finding the joy in what we do. And this is truly, this work, like you said, for most of us doing public health, this feels very much like a calling. We're called to this work. It's not, just, flipping through a catalog and pick this. Sometimes it starts that way, but when you're still in it after all that we've been through. This is a calling. This is more than just a job for all of us. So thank you for that reminder. Dr. Dixon, let's hear from you. I'd love to hear how you are amplifying voices in public health and what advocacy looks like for you.
Yeah, absolutely. And I always I always walk away inspired from just hearing all of you amazing women speaking and sharing your passion and your joy, Dr. Joy. I definitely powerful messages. And so, yeah, what I'd like to share is, again, I'm an epidemiologist, so I really see the value and that critical importance of representing people through the data that we have. And one of the things I really like when I used to work with the local health department and we would do our policy meetings, we would always kind of talk about like who is not at the table here today to discuss these policies. And I think we need to do that same thing in data collection to make sure that the way that we are collecting and sharing the data is equitable, that we're bringing in all those voices. We're looking at who's not at the table, who's not represented, and then how they're represented in the data. I mean, really approaching it's not always the easy way to do that, but it's the right way. I want to share an example something that really gave me a lot of fulfillment. I think it's one of the things that I'm really proud of in my career is I used to work in suicide prevention work. And when I was working in one side, kind of doing, case review and things like that, I wasn't happy with the way that data was being collected for our LGBTQ folks. I think there's still a lot of integration to be done there in pulling in that data and, understanding if people are members of LGBTQ communities or tribal communities, or, we're still doing a lot of work to bring in information about what's going on in people's community dynamic and in their individual lives. And then within that, that ecological public health scope that we want to strive for to get the whole picture. So when I had an opportunity to change the way that data was collected and really advocate for that in our data collection process and policy, that was something that really meant a lot to me, in making sure that those voices were heard. And now, as you said, it's a really trying time in public health. Some of that data that we work so hard to collect and bring to the table is not necessarily shareable public, in the portal that it was originally intended. And so speaking on that strength, right, and what we can do to get through this and get to the light and the joy on the other side. We have seen a lot of people who were taking the data sets that was previously published publicly by government entities or other organizations that had to take those down. People have actually been recreating those and posting them again publicly, which is amazing, right? Like I talked about this a little bit in our podcast, but to me, that feels like the people that were like saving the books in Alexandria, like I really appreciate that courage and that taking that onus on themselves to make sure that data endures so that we can do the good work in public health. And we are working with an organization, another epi consulting group called M&D Science Consulting. And we've started kind of collecting those data sets and those repositories and just a really simple like spreadsheet on a web page, but here's where to go to find these new data sources, and here's how to navigate the data that you might have had from a previous source so that you can still do that work and build that into your programs and your strategy, and showing that need for the work in public health that still needs to be done. So, I just want to share some of that. I think when I'm thinking about amplifying voices and looking ahead for this National Public Health Week, and we've got a lot of strength in our communities and our professional networks here.
Thank you for that. I love that. And it's so important. I think it's what I'm hearing from everyone is, and I imagine, if there were 20 of us on the panel, we'd hear 20 different examples and ways that people that we are, how we are amplifying voices, and collectively we can be reminded, even like listening to the four of us, some pretty powerful messages, right? And so imagine if with more of us, kind of with our focus of, what we can do and being reminded of what we can do and how important this is, we're quite a force, when we come together and lock arms and lean into this. So that's my big takeaway from all this, is just this reminder that, we're pretty awesome. The four of us had a lot to say. And as an industry, I know a whole lot of professionals. I would love for people watching this to add into the comments, like, what are you doing to amplify voices? I want to hear more of this, because, we're an industry of brilliant people and with a lot of really good thoughts and intentions. So I'm going to pass around just one more time and let you all share, your final thoughts, anything you'd like to say as we begin to wrap up this amazing conversation. Dr. McClamrock.
Thank you. Yeah, this is really powerful. This is powerful stuff. Yeah, just a couple notes I wrote down for myself. So, Dr. Joy, I really appreciate that you used the phrase "the weight of trauma," and this is a traumatic time for public health, and that does feel very heavy. And you also said that joy is a choice. I love that. I love that so much. I've been working hard in my own life, personally and professionally, to choose joy. And I actually think that joy and courage go hand in hand, right? When we are able to tap into our joy, that enables us to then go out and be courageous in our actions. Yeah, I mean, it's in our DNA, right? Like, public health is, I mean, it's a choice, but it feels like more than that, I think, for a lot of us. So I agree with you, Charlotte. We are quite a force, and we are a force to be reckoned with. And so, like, watch out, because public health, we are still here, we are still strong, and we will persevere. Yeah. Thank you.
Awesome. Yes, thank you for that. I love your takeaways. Dr. Joy, over to you.
Yeah, I'll just say, and I've said this in a previous LinkedIn Live, and I keep telling people this, don't lose sight of the opportunities that are around us. And when you think about it, the Underground Railroad happened because somebody saw opportunity in the midst of what seemed like insurmountable trauma. Like, just think about that. And if somebody could do that, y'all, we can get through this. We can get through this. We can pull our resources together. We can pull our people together. We can pull our communities together, because the power of the people is one of the strongest forces out here. So when things seem tough, when things seem like we will not overcome them, just think about that. And that's just one example. Just think about that. Think about how we got here, how we got to this point. If our ancestors, if the people who came before us were able to figure out how to get us to this point, we can figure out how to get the next generation further on down the line. So that's all I'm gonna say. I'm gonna leave it right there.
Oh my gosh. I love that so much. And I literally referenced something similar with my neighbor when we were walking just a little while ago. This is such a powerful, if it doesn't do anything for anybody else, this is absolutely fueling me today. And I appreciate what you just said. That's a very strong, very powerful reminder. Our ancestors have been through it, been through it. And yes, we can pull a lot from, and if they weren't your ancestors, you can borrow somebody else's ancestor story of resilience and perseverance. And so, yes, I absolutely appreciate that and agree with you. Dr. Dixon, any final thoughts from you?
Yeah, first off, y'all are a hard act to follow. I'm just I'm like, yeah, what she said and what she said, and her too. So first of all, I'm going to start off with just highlighting a few things from from what y'all have said. I agree. We are a force to be reckoned with. And I think a lot of the work that I've been doing on mindset, both in my personal and professional growth, has been around gratitude, finding that opportunity. I already know I have resilience. We've been through it. So that's there. Now it's building out, the gratitude and seeing things as an opportunity. And I see this as an opportunity to build up, our how tight knit we are in our communities, both our local and our professional ones. I see this as an opportunity to, again, just, as we're talking to people and we hear messages that we're like, yeah, other people need to hear this. We need to keep sharing it, and that's how we build up and amplify those voices. And, I started my business out of the love and passion that I have to protect, the not only public health, but the planet and every living thing on it, because I want my children to grow up in a world that is healthy and loving and balanced. And so we're not going to quit doing what we're doing because there's setbacks. We're going to find a way to come back even better and make us stronger. And again, like you said, I'm not even sure who said it, but linking arms, that's what we're doing as we work through this. And we have incredible connections in public health. And I've learned working in public health, these are some of the best people on the planet, honestly. And if anybody's going to figure out a way to get through it and have that strength and that, resilience and that connection, it's us. We're good. We'll be good. So yeah, again, y'all are a hard act to follow, but I'm just going to build on that a little bit and leave that at today and walk away, with a smile on my face today too. Thank you all.
Oh, that was great. That was awesome. Thank you. Thank you for joining us live, watching the replay, for doing the work in public health, for answering the call and being dedicated to this profession. Let's lock arms and let's keep moving forward. One last thing, our names are right there on the screen. If you're not already connected with us, please reach out, connect. We welcome messages and direct messages, but I really want them to fill in the comments so that we can keep, this going and keep it serving up in our network's newsfeed. And a little ray of positivity in the newsfeed is related to public health is very welcome these days. All right. Thank you all and have a fantastic rest of your day.